Hi everyone, my name is Elizabeth Woods. I am the Clinical Coordinator for the Distance Accelerated BSN program here at Emory University School of Nursing. This video is going to be information that you're going to need as a preceptor for our students in the DABSN program. We're going to go over several documents that the students will provide to you. There will also be information in there should you need to contact myself as the clinical coordinator, and also how to get in touch with the clinical site faculty. So let's dive right in. The first document is going to be the clinical rotation guide. So on the front page, you'll see that it's going to have the students' information, their email, a phone number that they can provide to you so that you guys can stay in communication. The clinical site faculty, which is an Emory employee who has been hired to oversee the clinical expectations and to be a partner with you in collaboration to ensure that the clinical experience for the student is positive and that they are meeting all objectives and expectations. My name and number and email are listed at the bottom. As the coordinator, I'm here to assist you if you're not getting the response that you feel like you need from the clinical site faculty. As the coordinator, I am going to try to accommodate and work with you to try to make sure that we are partnering and creating the best positive experience for both everyone, both student and unit involved. So if we move on through the document, we will see that the mission statement here for the School of Nursing is to educate visionary nurse leaders and scholars, generate and apply knowledge, and positively transform nursing, health, and systems of healthcare within the local and global community. I think that is even more important now with our distance program as they're getting an Emory education, but these students have opted to stay in their communities to work in clinical environments of where they want to be a change agent, where they want to advocate for populations, for healthcare. So I think this mission statement is more applicable to these DABSN than it's probably been in the past. You can see our strategic goals for 2015 and 2020. And then if we move down, we see BSN as outcomes. So here we have we say that the graduates of the Neil Hodgson Woodruff School of Nursing BSN program will have the following characteristics and behaviors based upon the AACN's Essential of Baccalaureate Education. So we have essentials 1 through 9. A little bit later, we're going to go through these in a tad bit more detail, but these are how we evaluate our students as to whether they are successful throughout their clinical rotations. The clinical practicum experience is a core component of the course. It is a requirement, of course, to sit for NCLEX. They have to have so many hours, but it's also an opportunity to apply what they're learning in the classroom in a real-world life experience. So students should be proactive and professionally engaged with experiences. They shouldn't just be sitting around. They shouldn't just be waiting for you to nudge them and make them get up and be curious and inquisitive. We think that they should be willing and positive to get up and make a difference and to also learn. This is their learning opportunity. We want them to take full advantage of this. So the next step is we're going to go through the roles of the people that are involved during these clinical practicum experience. The first one is the clinical site faculty visitor. This is to utilize the clinical site faculty for each student from the beginning through the end, so they kind of keep their same one. They work in conjunction with you guys. As the clinical site preceptors, we want to make sure that you guys have open communication, you collaborate, that this should be a pretty positive experience and partnership between the preceptor, the hospital where the preceptor works, and then the Emory University School of Nursing. The clinical site faculty will be in frequent communication with the preceptor, with the clinical site, in order to ensure that the student is being supported and all activities align with the course objectives. You guys can read through this. We will use Zoom conferencing, videos, phone calls, emails, any means necessary to make sure that we stay in constant communication and that you as the preceptor, we want you to feel supported. And this is the person who will best support you during this time as preceptor to our DABSN students. The clinical site faculty is the point of contact for the clinical preceptor and the student during the entire clinical rotation. We want to make sure that they have excellent communication. They do great follow-up. If for any reason the clinical site faculty needs additional assistance, they will then contact and escalate any issues to the clinical course coordinator. The clinical course coordinator, of course, coordinates the clinical courses, serves as a liaison for the clinical site faculty, and submits student evaluations at the end of rotations. The clinical course coordinator makes sure that the students are also meeting objectives, that they are professional, and that we have everything that we need to be an assistance to not only the student but the preceptor as well. As the preceptor, you are agreeing to provide the student with an orientation to the unit during the first day of clinical. We want to make sure that you and the student also have a cooperative and effective working relationship. So communication is definitely key. We want you to collaborate with the student and faculty member to provide assignments that will help the student develop. So if you recognize that the student is having an issue with bedside shift report, it's not accurate, it's kind of slow, it's missing some key pieces, we want you to communicate that with the clinical site faculty. And maybe there's an assignment, maybe there is a write-up or something that you guys could come together that you feel is necessary for the student to complete in order to be more successful in that learning environment. Notify the clinical site faculty if collaboration is needed in any aspect of the student's experience. Collaborate with the clinical site faculty in the student's clinical performance. You are not required to grade any papers, but we want you to be involved with the student's learning as much as possible. So if you have an evaluation of the student, if there's something that comes up while the clinical site faculty provides that final evaluation, you are more than welcome, and we encourage there to be some collaboration with this informal evaluation, and you're going to be doing weekly evaluations for the student. So communicate that with the clinical site faculty. We do require a BSN. We do want you to be as, we want a full-time preceptor, but we recognize that there are, times where a secondary preceptor may be needed. And of course, secondary preceptor BSN is required as well. Unit educator, hospital placement coordinators, those are the places, people within your hospitals who have come on board and agreed that this is going to be a partnership with the Emory School of Nursing. They kind of identify the proper unit, where they think would be the best place for the student to be, as well as the best preceptor to teach. We hold our students accountable here at Emory School of Nursing because we want them to know that they have to drive a lot of this experience. So each student must be mindful that he is representing the Nell Hodgson Woodruff School of Nursing during the clinical practicum. And is a guest of that clinical facility. We want them to be professional at all times, including reliability, dependability, practicing good communication, and being proactive in that learning process. So seeking new knowledge, experiences, going out and being a go-getter, being very curious and inquisitive. We want to make sure there is a positive experience. All clinical shifts for the students must be approved by the clinical faculty site visitor. Students cannot attend clinical without being approved. So if you change your, if the preceptor changes his or her schedule and just assumes that the student is going to be there, that's not going to be the case. So the student has to have shifts approved. It's normally not a problem, but we have to know where the students are at all times. Students cannot attend clinical if they have a class day. So if your normal working day is on a Monday and students have class on a Monday, they will not be able to work, nor will they be able to work the night before any class day. Attendance is required at all scheduled clinical practicum shifts. Chronic tardiness and or absences are not allowed. Makeup shifts, while can be arranged, they have to be at the discretion of the clinical site faculty, preceptor, and of course the clinical site. We don't want to make that a very regular occurrence. Professional behavior is required at all times. We want to make sure that they understand that they are representing Emory and that they are also a visitor at that clinical site. We want to make sure that they also abide by the professional appearance attire. So they need to wear their Emory scrubs. They need to wear their name badges. They need to have the proper shoes on, their hair pulled back, be very neat. The same requirements we have for our students who are on campus applies to the distance students as well. Students are not permitted to administer blood products without their preceptor present. They're not to be that second signature on blood products as well. They cannot administer medications without the direct supervision of a registered nurse. You cannot give them a colace and tell them, hey, just go give this to Mr. Smith real quick while I take an order. No, you have to be there. The preceptor has to be there, or a registered nurse has to be there to oversee that at all times. The student may not take a verbal order independently without you being present. Now, does that mean that they can't ever take a verbal order? No, it means that they can't take it without another nurse being present. Now, you can be on the phone, it could be on speakerphone, and that's a great learning opportunity for them. But someone has to be there to make sure that the order that they're taking off is accurate. They cannot independently remove medications from an Omnicell or Pyxis. They are not allowed to do that. Complete orders without first verifying with a registered nurse. They can't take orders off an electronic medical record without first verifying with the nurse that this is okay, because they have to understand how to implement that. And ultimately, we want to make sure that the nurse is aware of all orders being taken off. They may not perform invasive procedures without the direct supervision of a registered nurse. This just goes down and talks about the BSN. You want to make sure that you supervise the student through the entire rotation. They have to let you know where they are at all times. We talk about the benefits to the preceptor. So you definitely are recognized with the Emory School of Nursing as being a partner in the DABSN education of our students. We want to invite you to Emory School of Nursing if you're ever in Atlanta, and also virtual webinars and lectures to gain free CEs. We want to give you access to our library and research that we have going on. That's definitely there for if that's something that you would like to know about. There are also some states that offer tax incentives as well. So the benefit of having an Emory student is that they're high quality training from an Emory nursing program. There's definitely mentor opportunities. You're giving back to the nursing profession. We know that there's a shortage of nursing, and this is a way that you can give back to ensure that the nurses being trained are properly trained, as well as it's a recruitment and retention strategy as well, because these students are committed to staying in their hometowns and their communities. They want to work there, so it's an opportunity for you to have recruitment and retention. So with clinical teaching, we want to make sure that the goals and specific objectives for clinical experience, the preceptor will work closely with the student to assess their needs, individualize objectives, start and end each day with a brief conference. So the student has to know, what's the objective for the day? What are we going to accomplish? What do you need to work on? That's something that's going to be your responsibility, and the student is going to have to do some follow-up. The course clinical coordinator will provide a guide for clinical day documents, so there will be something to kind of guide you along. We don't want you to feel like you're kind of doing this all on your own. You do have assistance and help. The preceptor's role is to make sure that the student's objectives for the day and week are being provided. You utilize teachable moments. Don't just assume that the student understands you're doing, that they know why you're doing what you're doing, right? Just because you put the head of a bed at 30 degrees to prevent aspiration doesn't mean that the student knows that. They're learning. So talk as you work. Explain your critical thinking as a nurse, how you set priorities. What would be the first patient you would see in the morning? Why are you doing that type of assessment on the patient? Those sort of things. Evaluation, you want to ask the question, how do you think you did today? Some things like that. You were very effective. Do you understand what this means? Let's look at if you're meeting your objective. So just those open-ended questions that will kind of, delve into a little bit more deeper of how the student is given. And then the clinical site faculty will also make sure that, the formal evaluation is completed. And then also we have a clinical skills inventory here. Again, not everyone has been able to come into contact with every single one of these clinical skills. We hope they do by the end of their nursing school journey. However, that's not always possible. But if they could add things during the clinical rotation to this, that is an amazing benefit to them. So they should come with this filled out, performs independently. They've been taught physical assessment very in depth at Emory University School of Nursing. So they should be able to perform a lot of that independently. But they may have never done an enema, right? But they want to know how. So it's things like that that you can go through with them and try to check some of these skills off. So once you read this and you agree and you recognize and there are no other questions that need to be clarified, we want the preceptor to sign and the student to sign as well, because this needs to be turned back in to the School of Nursing. All right, we'll go on to the clinical student tracking time log. Very straightforward, not hard at all. Date, time in, time out, and preceptor initials. Here is, say the student had to do just a 6-hour shift for whatever reason, any kind of explanation for the off, the abnormal, lapses in times. That's where we want to have an explanation, and then preceptor should always sign even if there's nothing here in explanations. This is the incident, injury, and pathogen exposure report. If for any reason the student were to become injured at work, in clinical, were to become have a needle stick or a splash or something that is an incident, the student must fill out Emory's form, as well as we would want to make sure that they followed hospital protocol as well. But they must immediately fill out the form and then call their clinical site faculty. It's very straightforward. It talks about the date, the type, who is your preceptor, what's the number there, what kind of incident was it, what kind of exposure, and then the clinical site faculty has their piece that they need to do to make sure that the student is protected and taken care of. Earlier, we talked about the BSN Essentials. This is what we use to evaluate our students during their clinical rotations. So if we go right here, we say evaluation should be measured as first, second, third, and fourth semester. First semester is that they are meeting objectives, directions, guidance with supportive clinical instructors no more than 75% of the time. And then as we move on through first, second, third, and fourth, the support is decreased. The percentage of support is decreased from 75% to 10%. The fourth semester is seen as a senior practicum, so we know that those are students that are getting ready to graduate, and they should be needing minimal supervision at that time. So as we move on, we want to make sure that the students are progressing. So that's when you're doing those weekly evaluations. Are they able to move on, and are they able to progress appropriately? I'm not going to read all of the essentials, but you can see that there are subpoints to each essential. We understand that not every student will come in contact with every single subpoint, but we want to make sure that we provide every opportunity possible that they have that exposure. Everyone has the opportunity to demonstrate curiosity and inquiry. Everyone has the opportunity to identify and take initiative to their own learning needs. Everyone can compare observed clinical practice with published practice standards. That's evidence-based practice is what that means. Using scholarly resources to answer clinical questions. So they have a question about something, they can look that up. They can go and find a peer-reviewed article to support that evidence-based information. So I'll let you guys read through those. We want to make sure that we check as many boxes off as we can. And the last document I have is the strategies for providing constructive feedback to students. So sometimes clinical instructors, they let me know that providing feedback is one of the hardest things they have to do, right? No one wants to tell someone that they stink at something or that they need improvement. We always want to say that was a great job, you're doing amazing, and hopefully that is the majority of the case, the majority of the time. However, there are times where people have to have feedback. We all need feedback in order to improve. So this is a great article. It's about a page long. It's not very in depth, but it does give some good detail on the role of feedback. Communicating constructive feedback is essential to teaching and learning. And when students are in clinical, they are learning. You are teaching. So feedback is going to be necessary. And it doesn't have to be done in a hateful manner. It doesn't have to be done in a very negative way that it, grossly impacts the rest of their clinical practicum. But it just provides them an opportunity to improve. So that is the conclusion for all the documents that you will be provided by your students. I understand that there will probably be times that you will have questions. Maybe right now you do not, but next week you may. Please feel free to reach out. Feel free to always feel like you have support from Emory. We are very grateful for the work that you are doing. We are very grateful for the teaching opportunity that you are providing and that your hospital has provided for being a partner with Emory. Again, my name is Elizabeth Woods. I'm here to be a support and to make sure that our students have the best clinical learning experience possible and to make sure that you feel very supportive. Take care.